Good morning, everybody. Dr. Josh Wilson here with Wilson Chiropractic. I hope you guys are all enjoying your Wednesday morning. We had an interesting case that came into the office a few months ago, and it was a young lady who was suffering with some seizures. And then the mom had been a patient of ours already, and unbeknownst to us, the child was suffering this. And when I mentioned to her that we could help, she started kind of digging into the struggles the kid was having in the past. And this was a perfect example of one of those cases we see where the child had numerous health issues of one just rolled over from another. And every one of these issues that this child was having, the doctors just kept telling her, oh, she'll grow out of it, she'll grow out of it, she'll grow out of it. And we actually have a couple of forms here in the office that we go over because we hear that a lot in the office. And this form right here, it's actually a version of some teaching tools that we use that has a lot of, it's tough to read on there, but those of you who've been in the office, you see there's one side of this just has a bunch of different health issues that the child's had. And it started with this young lady with colic, and the colic then turned into reflux. The reflux then turned into allergies and respiratory stuff, and then which eventually led into eczema, which then led into ear infections, which then turned into more of the behavioral issues, which then eventually led to her having seizures that they just couldn't determine what the cause was. And then when we dig into the initial consult with mom, which is the form that we use right here, we call it the perfect storm. And we started digging into where all this started. And for her, it started with a stressful pregnancy. And what we mean by stressful pregnancy is mom had to do the IVF treatments, and then from there she had to do multiple ultrasounds because she was considered high risk. I think she ended up having like 9 or 10 ultrasounds. Then from there, mom was induced into labor, which stressed out the baby. Baby got stuck, and then from there they ended up having to do a vacuum extraction, which was stressful on the baby. And then from there, the child's been on numerous antibiotics. I think by the time we saw her, she'd been on about 10 rounds of antibiotics. A lot of stress and anxiety within there, a lot of impulsive behaviors. Mom said even as a child, she noticed her rocking and just hitting her head, which come to find out that's a soothing technique that they use because of an overloaded, stressed out nervous system. From there, it led into, well, not led into, but this goes back to the early warning signs over there, which were the colic and the sleep issues, the reflux, difficulty nursing, the ear infections. To us, those are warning signs for a nervous system that's not adapting well, which ultimately led to a child at 10 years old having multiple seizures that the neurologist and the other specialists couldn't figure out. Now, fast forward to today, that child's been under care here for about 6 months, and she went from having 1 to 2 seizures a week. On a bad week, she would have 3 to 4, to she hadn't had a seizure in 3 months. And nothing's changed outside of there other than us getting her regular adjustments. So that's where we want to go into. If you ever hear a doctor say your child will just grow out of it, that's a warning sign to keep an eye out for other health issues that may stem across, because that's just one case of multiple cases. And that's what every time we have a kid come in that's in that 8, 10 to 12 year range who's always chronically sick, that's when we dig into this right here, and we always find, I know it's tough to read, but we always find multiple check marks on their past health issues that children have had. So let's not wait until they get to that point to where it's seizures. Let's get them in here when it's colic or reflux, or even before that. Let's get them in when they're first born to get them checked, because I guarantee you if that child would have been checked from birth, she would not have had over 25 seizures by the time she was 10 years old. So let's put a stop to that. Let's get these kids in here sooner and earlier. There's never, I just had a mom ask me a second ago because her child is going to come in and get scanned, and we're going to get her on a care plan. And she asked me, when do we start? And I said, the day they're born. That's the most important time to check them. Let's not wait until they develop all these issues to get them checked. So I hope you guys found a little bit of knowledge and understanding out of this video. Share it with somebody you know who's got a kid who's struggling, who's always sick, who's been told they'll always grow out of it. Let's not let these turn into chronic health issues as they get older. Let's get them checked and get them in now. So we appreciate you guys. Like I said, tag somebody or share this video with them, and we'll see you guys next time. Take care.